This short video explains population health management in Suffolk and North East Essex. Population health management involves using patient data to improve healthcare services. This brings benefits for whole communities as well as individual patients. In Suffolk and North East Essex, population health management data is taken from patient records in primary care, for example your GP surgery, secondary care, such as hospitals, mental health services, community care, social care, and more. The data is pseudonymized, meaning personal details are removed from the information before it is shared. This keeps identities safe while allowing health and care history to be viewed. The data is securely stored, with access limited to trained professionals in Suffolk and North East Essex. This data is used to improve both indirect care and direct care. Indirect care improves services for everyone. This includes looking at groups of people with similar health needs to see what services they may need now and in the future. For example, using the population data to track changes in healthcare need and usage over a 5-year period, we can predict future population health trends, assess where demand for services will grow, and target resources to implement preventative strategies. For example, cardiovascular health programs, using analytics to identify where extra help and services are needed, and whether there are any gaps in services, like reviewing data for patients at risk of or diagnosed with type 2 diabetes, and identifying gaps in preventive services, such as regular blood sugar screening and monitoring and lifestyle support. Direct care helps individual patients. By using this data, healthcare teams can be proactive in identifying patients at risk. This allows them to offer targeted support and services, ensuring that those who need care most are reached and supported at the right time. Healthcare professionals may request data to contact patients who could benefit from certain services. Examples include a GP using population health data to identify patients who are more likely to have high blood pressure and therefore heart attacks or strokes, and inviting them for a blood pressure check. A falls prevention service using the data to find patients who may be at risk of falling, then contacting those patients to offer them support which may prevent falls, such as strength and balance classes, or a visit from an occupational therapist to see whether their home is safe and free from trip hazards. You can choose if the data from your health records is shared for research and planning via the National Data Opt-out. Learn more by visiting www.nhs.uk/your-NHS-data-matters. Opting out can mean that your data won't inform future service planning, and sometimes you will not be identified by the programmes who find people who fall into at-risk categories. This means you may not be offered preventative care you may benefit from. Thank you for listening. For more information, visit www.sneeics.org.uk.